because I wasn't sure I'd be able to speak at the meeting, so I wrote it down. Sure. But one of the things is from the time I got sick when I was 15, and I'm 50 now. So I've been uninsured, on Medicaid, Medicare. Currently I'm on Medicare, and also been in a program that my employer paid for my insurance, which was great. But a few years back, when I applied for Social Security Disability, there's a 2-year waiting period before you get Medicare. So that was 2 years of being totally uninsured. And we, another person and I advocated to have that changed and didn't get anywhere with it. So that would be, in my mind, one small way that healthcare could be changed. If that 2-year was taken out when somebody is qualified for Social Security Disability, that 2-year waiting period is gone. Because in my thought, and this might sound kind of crass, and I said this to some of the representatives that we talked to, that basically the government's waiting for 2 years, hoping that we'll die before we can get Medicare. That's the way I looked at it.
Well, and you have every right to feel that way. If we get this bill, and if we'd had this bill in place, you wouldn't have had a 2-year period, because what you could have done during that interim is, instead of waiting 2 years without insurance and not having anything, you could have gone, again, if you wanted to, and I would assume I would hope you would, you could have gone into the exchange. And it would have been basically based upon whatever your income was, and you would have had basic health care coverage for that 2-year period of time. Or you could have tried to negotiate, but you probably wouldn't have in the exchange, because maybe the insurance companies probably wouldn't have wanted to pick you up because of pre-existing conditions.
And that was the other part of it too.
Right.
Pre-existing conditions, even if I'd been able to afford it, I probably would have been opted out because of different things. So.
Right.
But anyway, I wrote down some things I'd like to give you, all
Sure.
suggestions about what I thought, because when you're talking about different businesses who give people health insurance now, if the government does have that program in place, what's the incentive for them to keep covering people if the government's going to do it? And with health care costs so high, why would they keep insuring or offering insurance to people if it's going to be cheaper for the government to do it? So you're losing an option. People would lose an option, is what I think.
Well, they could, but again, if the employer, as I said, if the employer said, well, I'll just let the government take it over, and they choose to dump everybody off the plan, those people have every right to, and that business should be responsible for that. But we're going to give tax credits to businesses so that they can, and hopefully, with premiums coming down by covering the uninsured, with giving tax credits to businesses that do provide health care. And it's hard for businesses. I feel bad for a lot of them. They're barely being able to do it if they can. And now with what's happening, because of the rising costs, they have to go back to the employees. There's a higher share of the employees pay, or they get a policy with a much larger deductible. So basically, the policy becomes weaker for the person that has it, because, or weaker, I guess, because it's so costly. But for your employer, if we gave them tax credits, and they could go, and it gives them the right to go into the exchange too. They can negotiate with healthcare providers, and hopefully give you a better policy for less money, because they're getting credits and they're going into the exchange where there's real competition. You see, right now, the whole thing is, I just don't see any competition in the healthcare industry. I mean, there's nobody to compete with them. And again, I'm not an anti-insurance company, but I'm just saying, it's sort of like Mid-America Energy that I was talking about at my house up at Moline. They're the only provider of electrical rates and gas and lights. If you don't like your rates with Mid-America, you have two options: pay them or get your electricity shut off. And I think that that's wrong. I don't see anything wrong with good old-fashioned competition. It won't drive people out. Look, there's a tremendous, if you look the other day at the stock market, it went down 186, almost 190 points, a real bad day. The 7 biggest gainers that day were healthcare and insurance companies. Why? Well, because they think this plan's in trouble, and quite frankly, I think it is. And but the figures just don't lie. Look at the market from about, I think it was, I think it was last Friday when the market dropped 186 points. But look at the top 7 stocks that went sky high. They're also one of the major industries during a recession and have recorded record profits besides the oil companies. So there's something going on out here. And I'm not adverse to companies making profits. I really am not. But the CEO of Aetna, per day, makes $200,000. Now, if anybody here doesn't think that's excessive, then more power to you, but I would love to have that, and I don't think anybody here would turn that down either. But this is the same company that's making this woman have to pay a $118,000 claim. So when you think about that, her claim's $118,000 and he makes $200,000 a day, well, for about